What's up, you guys? Welcome back to Millennial Nurse TV. My name is Lois. If you don't already know me, what's up? How you doing? How y'all feeling? This video, we're going to be talking about the COVID vaccine. This might be touchy for a few people, so I'm just going to do a little disclaimer. Y'all know I got to be real politically correct with this video, okay? I'm not out here to tell you to get the vaccine, okay? And I'm not out here to tell you to not get the vaccine. At the very end of the day, we are all grown adults, okay, that are very capable of coming up with our own informed decisions. So you do you, boo. I'm just out here to kind of give my take, answer a few questions, then leave. With all that being said, let's just go ahead and jump into the video. Alright, so to begin this video, for you guys who don't know me, yes, I am a registered nurse. I work in the hospital. I've been a nurse for 3 years, and I'm currently a travel nurse out here in Miami, Florida. Okay? So I don't even really know where to start with this. I don't have no notes. I didn't want to be like scripted with this video. All this is raw emotions. What you see is what you get. So I'll kind of start with first vaccination. Do I think people should get vaccinated? What is my personal opinion or my personal take on it? So like I said in the intro, you do you. All I can speak about is me and what I felt was best for me, I guess. So I am vaccinated. I actually recently, not super recently, but I got vaccinated over the summer. I want to say it was like end of July, August. So yeah, I went back home. I took the summer off, took 2 months off, and I got vaccinated. I kind of not agree. I understand both points of view. It actually took me personally a long time to finally like feel comfortable getting vaccinated. So for people who are not vaccinated, like, I do kind of understand where they're coming from. Like, people do have their doubts, and people are entitled to their doubts. Like, that's on them. What kind of helped me come up with my decision, I incorporated my personal experiences as a nurse, and I kind of like, I had the summer like away from the bedside, away from the hospital, to kind of think about what I think, whatever I feel, and at that moment, that's kind of what I felt like was best for me personally, okay? So that's just me. I'm not gonna get super deep as far as my research and all that, because like I said, I'm not out here to convince you to do one thing or the other, okay? So yes, I am 100% vaccinated. Now, so there are nurses who are not vaccinated. There are doctors who are not vaccinated. There's other members of the healthcare team that are not vaccinated. A frequently asked question is it mandatory? So if you would have asked me this a month ago, I would have told you no. Because as a travel nurse, when we're onboarding for assignments, I want to say like earlier in the year a little bit, they had little like vaccine decline forms as part of onboarding. I'm not gonna take two. I'm just gonna record straight through. But yeah, so earlier in the year, like middle of the year, summertime and earlier, yeah, going for jobs, there was an option to just decline the vaccine. Now in this video, this is October 2021. And there are some hospitals that are making it mandatory. I'm actually on an assignment right now in Miami, and my hospital is actually making it mandatory. I want to say October 1st, 2021. That was the deadline for their staff. Everyone must have had to have at least had the first dose or the first shot. Or they get fired. So yeah, certain locations are buckling down. Certain locations are stricter than others. Location like California is really strict. I think New York is really strict. So it definitely depends. As far as nursing goes, because I'm a nurse, I can only speak about nursing. There are jobs and hospitals that will allow you to work if you are unvaccinated. But I feel like as the year goes on, as time goes on, more hospitals and more facilities are going to be moving towards, they want everyone to be fully vaccinated. Now, the whole firing of nurses or healthcare providers or healthcare workers in general, at the time that I was getting vaccinated, it wasn't mandatory. So that wasn't like an extra like push for me to get vaccinated or anything like that. I personally didn't feel any like pressure to get vaccinated. At the time that I got vaccinated, plenty of hospitals, plenty of jobs were offering you the option to decline. So my decision had nothing to do with like job security or anything like that. Like I said, my personal decision to get vaccinated did not come from a place of pressure. That was me. This was summertime. Now, currently right now it's fall, and I can speak about the staff nurses at the job that I'm at right now that are still refusing to get vaccinated. Some people really feel strongly about it, not just nurses, doctors, anybody in the healthcare team. So when I refer to nurses, it's just because I'm a nurse, but this applies to everybody. There are people who are extremely passionate about their decision to not get vaccinated, and they are willing to quit. So yeah, I have coworkers right now that are quitting. I think they gave them until the end of this month, so like Halloween, they gotta go. And some nurses are like really pissed off. Nurses, doctors, you know what I mean? Some nurses are really pissed off about that, which I feel like they have every right to be upset. Last year we were heroes to everybody. Everyone was calling nurses heroes. All healthcare workers were heroes, blah, blah, blah. And now we are unemployed. When I say we, even though I'm vaccinated, I still stand with my nurses. Like, I totally understand everyone's point of view. Like, I have kind of a broad view. I get both sides. So I think it is very unfair that hospitals are at this point bullying and pretty much threatening nurses with their jobs, because that's essentially what it is. It's pretty much get the vaccine or we're gonna fire you, which I don't think that's right at all, because last year when COVID hit and nobody had any answers, y'all ain't have no answers for us. It was the nurses that were front line, and I want to specifically highlight nurses because y'all know doctors, they go in, they do their time, and then they're out. Nurses are literally bedside with the sick COVID patients for 12 hours mostly. Front line. I can't do my job without touching patients. Sometimes doctors come in, kind of stand at the end of the room and do a little assessment. Oh, how you doing? The nurse is literally front line. So I do not agree with the fact that y'all want to fire these nurses that were literally risking, not they, we were all risking our lives for y'all just a year ago, and now we are going to be unemployed. Okay, I am very like pro-choice. Like, do whatever you feel like works for you. So I don't agree with the fact that hospitals are kind of forcing it upon people, because there are people at this point who are getting vaccinated because they just don't want to be out of a job. They don't have the option to travel nurse. That's another thing. You can travel nurse unvaccinated as of right now. Not every hospital is forcing that issue. So what I'm seeing is that a lot of staff nurses are gonna keep quitting their staff jobs to travel nurse. Like, over this pandemic, travel nursing has become like, I don't know, like the new wave of nursing. Like, anybody who meets the required experience, okay, has been kind of jumping on travel nursing. So there's like more and more hospitals now. When I go to from one hospital to the next, there's less and less staff. So with this whole forcing nurses to get vaccinated, I mean, I feel like after a while there's gonna be no staff nurses and just straight travel nurses. The only exception would be new grad nurses, because they wouldn't be eligible to travel nurse. So yeah, y'all forcing this issue is not gonna be a good idea, honestly, as far as the hospital's concerned. I personally don't think it's gonna be a great idea as far as staffing is concerned. Yeah. Another point I want to make, I feel like people assume that just because you work in healthcare that you are like obligated to agree with the CDC's research and rules that change every day and all that. Like, that's not the case. I've seen little things like, how are you a nurse and you're not vaccinated? How are you a doctor and you're not vaccinated? Like, just because somebody works in the hospital doesn't mean they automatically have to like view things a certain way. Not everybody who works at Olive Garden likes pasta. You know what I mean? Like, just because we work here doesn't mean we agree with the things that they're saying on the media. Because at the very end of the day, nurses and doctors and CNAs and everybody, respiratory therapists, shout out to RTs, I love RTs, everyone has seen their own personal like situations. We all have stories that kind of, or we all had that one shift that was like, all right, I'm gonna get vaccinated, or that one patient that made you feel like, all right, yeah, it's time. So yeah, people have their own different experiences. People have a reason why they feel a certain way about whatever. So I think in general, like, stop the vaccination bullying, because essentially that's what it is. I think people should make whatever decision that works for them. And also to the public, I want y'all to stop looking towards like celebrities or influencers to kind of make your own decision. Like, people will literally say, oh, LeBron is vaccinated, so I'm gonna get vaccinated, or Kyrie Irving isn't vaccinated, so I'm gonna not get vaccinated. Like, use your brain. I hate to sound harsh, but we all have a brain. Use it, okay? Form your own research, come up with your own decision, and do you. I want to say that's it as far as like surface level, my opinion. Leave nurses alone, leave doctors alone, leave healthcare workers alone. Allow us to work the same way we worked unvaccinated while y'all was figuring it out. Is the same last year when nobody wanted to be on the front line and we were, is the same way that we can still do our jobs safely with proper PPE, proper protection. And I feel like there's other things in place that can be done to make sure everyone is safe, that doesn't require firing nurses. Because honestly, if we really want to talk about it, there's already such a horrible nursing shortage in America. Like, there's literally no nurses in America. And actually, let me rephrase that. There are nurses in America. There's a bunch of nurses in America, but there's not a lot of happy nurses that are willing to work under these conditions that have now become the normal. When I say conditions, I'm talking about staffing ratios, unsafe patient acuities, and all that. Every shift I work, we're short staffed. So I feel like there's already such a really bad nursing shortage. Y'all doing this whole firing mess is not gonna end well. It's not gonna end well. Who's gonna be taking care of these people? Like, y'all have already made nursing not super fun anymore. You know what I'm saying? Like, we've been through a lot. A lot of nurses are burnt out. So y'all want to add this whole restriction. I mean, I'm really worried because I feel like in a few years, who is gonna be taking care of me? Who is going to be taking care of my family? I want to fire all the nurses. Somebody got to save lives. So I don't think this is a smart decision. I don't think this is going to end well for y'all. I saw something about New York firing nurses at the midnight hour. It's getting ridiculous. Personally, it's getting ridiculous to me. So yeah, that's just my personal opinion. I'm not out here to debate with y'all in the comments. If y'all have y'all's own personal opinion, create your own YouTube channel, make your own video. Do you, sis? Do you, sir? You know what I'm saying? Like, this is my video, my channel. If you don't like it, you can keep moving, okay? So yeah, that's about it. That's all I can really think of without getting too deep. If y'all have any further questions or anything like that, follow me on social media, tap in, and I'll see you guys in the next video. Bye.